stay after that. Now, they have been saying about maternity. That was equally good. My 2 children were born there, and I have nothing but praise for the nurses and all those. Now, the NHS says that they have objective of this King George Hospital, and they say that I'll read that which was written in that one. The trust is committed to working closely with the partners in the community to place patients' need at the center of its services. I agree with that also. You will be all agreeing. But listen to the next phrase which they are saying. The trust primarily aims to provide the right care in the right place in the right time. Now these are the things. Once this trust is, this A&E is gone, all this is wrong. Right time, right place is gone. Because here you can see that A&E covers quite a lot area. And how long does it take to reach there if there is a, God forbid, there is a heart attack? I would say to you, this is your responsibility and my responsibility. Make this hospital remain open. A&E will remain open, and the maternity will remain open. After all, we are the taxpayers. We make the payment. We do not apologize. This is our need, and we need this hospital. And whenever the recorder is asking you for another march, I will request you. The numbers you came here, I want double and triple numbers to come and join with them and tell them that you, your family, you're all concerned. Finally, I'm grateful to Mr. Ali, Redbridge Islamic Center particularly, and our councillor Mahbub Chaudhry, those who are taking interest in organizing these gatherings, and I hope that this will go on until the government or the NHS, whoever is responsible, they agree with our demand and keep the hospital open and give us a good service as it used to be. Thank you very much.
Thank you. It's not only one story, there's a thousand stories. Of our far left, she's not left by the way, a friend of the King George patients, Chris Carter, who was taking this task mostly every week. I've seen the latest pictures, Chris Carter himself with our Ilford South MP right on over my gate in Ilford North MP right on the Lee Squad but at 10 Downing Street. And I hope this campaign continues and it's still not the 10 Downing Street. Chris Carter.
I'll stand up if you don't mind, because they probably won't see me otherwise. Well, good evening, ladies and gentlemen. When we broke the story that King George Hospital A&E was threatened with closure and the maternity unit, I was very keen to make sure that we presented you with the facts. Because it's really important, as far as I'm concerned, that as a local newspaper, that we do the best for the community, and the best for you is telling you what's going on and what the facts are. I had a meeting with Heather Amara and 2 of the doctors, with a couple of my reporters as well, shortly after we broke the story, which was a bit of a shock to them, I'm afraid, because they didn't really want it to go out. But we had a meeting with them, and she was very, very clear to say that closing King George A&E and the maternity would be for the better health of the borough of Redbridge. She said the people of Redbridge would be better off for that. Now, when someone in that position tells you that, you want to believe them, because you don't want to suggest that what they're saying is not true. So I gave them the benefit of the doubt for the first months, shall we say, of the stories that we ran. But after a while, it appears that what she's been saying is not quite the fact, shall we say. She said that all the clinicians, all the doctors in the borough support these plans. Well, we discovered, and also with the help of, I would say, Councillor Lorraine Sladden, we discovered that that's not the case. Lorraine Sladden wrote to 120 doctors, GPs, and I think she had a response of about 90%. and of those, around 90% were against the A&E closing. So clearly that's not the case. We've also found out, or it has been suggested, but we will find this out, that the doctors that are in favour are the doctors that will head the poly systems, who will run the polyclinics. So obviously it's like turkeys voting for Christmas, really, isn't it? It's, you know, they are going to be in favour. She also said that don't worry, because polyclinics will be built, and if the A&E is closed, people will be able to go to the polyclinics. We will encourage people to go to the polyclinics. Not for major emergencies, but for minor emergencies. Now, we've discovered, and I think Prince, council leader here has a story to tell about this, that if you go to the Oxford Polyclinic, if you have a minor emergency, you'll probably get sent to the A&E, because they do not take walk-in patients. You have to make an appointment. So that was not true. We were told, and this was stated in the public meeting that we held, I think it was last year, wasn't it? We were told that no heart patients go to the A&E at King George Hospital. Within 10 minutes of Heather O'Mara making that statement, there was an A&E nurse who stood up and said, well, that's funny, because I've had 2 heart patients in the A&E in the last 2 weeks. So clearly that wasn't the fact. We were told no trauma cases get taken to A&E. And when they say trauma cases, that's not heart patients or stroke patients, people in accidents, that sort of thing. We were told they're not taken by the paramedics or the ambulances to A&E. And yet we know for a fact that trauma patients are taken. We know that when Whipps Cross is full and when Queen's is full, which they often are, they have to go, the ambulancemen and the women have to take their patients to King George A&E. So it's very much like the last time that we campaigned, which was in 2006-2007, where they launched the Fit for the Future campaign review of health services, which suggested the same thing, which was to close A&E. It's very, to me, these plans are very much the same, because the Fit for the Future plans were put in the bin, basically, because they were flawed, and they were told to go back and come back with a better plan. They think this is a better plan, they're confident it's a better plan, but I think week by week, month by month, we're showing that it's not a better plan, and it's not going to be for the betterment of your health if they close A&E or maternity. What I'd say to you is please, please, keep fighting for A&E. I know I've heard stories this week that their staff at A&E are saying, what's the point in campaigning? It's going to close. We're losing our jobs. It's going to close. What's the point? There's a lot of point. And as far as I'm concerned, people power can win the day with the support of all the politicians, the MPs, the councillors, and obviously the newspapers in the area, in particular, obviously the Ilford Recorder. But we need the support of people like yourselves and the whole of the community of Redbridge. We need your support. We need you to join the marches. We need to tell them, we need to give them a strong message that we do not accept these plans, we will not accept them, and we will fight them all the way.